Very good afternoon to everyone. On behalf of Dr. KK's Heart Care Foundation of India, I welcome all of you to our 67th webinar. I would like to extend a very warm welcome to our co-host for today's session, Professor Ramandeep, Head of Department Mental Health Nursing, Faculty of Nursing, SGT University, and Ms. Ruchika Duggal Chaudhary, Assistant Professor, Mental Health Nursing Faculty of Nursing, SGT University. I welcome Dr. Rahul Pandit, uh, who is the Director, Critical Care, Fortis Hospital, Mumbai, and member Task Force Maharashtra. Today he will be speaking on the perspective of the people regarding third wave of COVID-19 in India. Before I invite Dr. Pandit, I will request now our co-host, Professor Ramandeep, to propose a welcome note. Professor Raman.
Thank you, sir. Thank you so much. Greetings of the day to one and all present here for the webinar. I welcome you all in this collaborative webinar by SGT University and Heart Care Foundation of India. I, Professor Ramandeep, on behalf of SGT University, welcome the esteemed Dr. KK Kalra, sir, who this fine afternoon is the respectable host of this valuable webinar of this fine afternoon. Sir is the former CEO, NABH, Quality Council of India. Presently, he is Director, Quality and Safety, Heart Care Foundation of India. I welcome you, sir. I am also privileged to welcome Dr. Rahul Pandit to this webinar. Dr. Rahul Pandit is a senior intensive care consultant with over 2 decades of experience. And right now, he is the Director of Critical Care Medicine and ICU at Fortis Hospital, Mulund. Having a prestigious fellowship of Joint Faculty of Intensive Care Medicine Australia, Sir plays the lead role in setting up ICU policies, protocols, and patient care algorithms. He has also completed a European Diploma in Intensive Care Medicine. Right now, he is also an esteemed member of the Maharashtra government's task force on COVID-19. This task force plays a key role in establishing a patient management protocol for serious and critically ill patients. So we all feel that, sir, you are the right apt speaker for this webinar. He is also a member of the Fortis Hospital Medical Council, and Dr. Pandit has numerous publications and book chapters to his credit, along with guest lectures in several national and international conferences. His areas of interest include critical care, echocardiography, trauma, neurotrauma, obstetrical emergencies in ICUs, proteomics, and sepsis. Once again, on behalf of the entire SGT University, I thank you so much for honoring us with your respectable presence in this live session by accepting our invitation. Also, I would like to add here, it is truly an honor, sir, to have the position of co-host in your presence in this seminar. And last but not the least, I welcome all the participants to this webinar on perspectives of people regarding third wave of COVID-19 in India. As today is the time when we have so many questions regarding the third wave of India. So I think sir is the right person to answer all that questions and tell us the right things, what we should do and what is the road ahead. Thank you, sir. I welcome you again.
Thank you, madam. Thank you very much for the kind introduction.
Dr. Rahul, before I invite you, just a little brief on the update about the COVID in India situation. Even we all know India is passing through the second phase of COVID-19, and in the last 24 hours, 45,352 cases, new cases has been reported, and 366 deaths. And out of these 45, Kerala is contributing to 32,097. and 188 deaths. Maharashtra has added 4,342 and 55 deaths in the last 24 hours. So if we see the vaccinations, because we know the so-called third wave, which we'll be discussing in detail today, vaccinations and universal masking are the two only effective tools to combat this COVID-19 and to prevent the third wave. Vaccinations received so far are 67 crores, 9 lakhs and 59, around 67.9 crores vaccines have been given. And out of these constitute 2 doses, if we see, of vaccines have been received only by 16.5% of the eligible adult population. And single dose, 54.7% of the adult eligible population has received. So far, we are very far away. And the mission objective of government is to immunize all eligible by the end of this year. Very soon, because there is a threatened third wave, and it's saying that it will affect children more than adults. A lot of queries, and most of the schools in India, in the most of the states, have opened up. Many were opened even before 1st September, and many like Delhi and other states have opened schools for higher classes from the 1st September, which again, a lot of queries and questions are there in the minds of parents and other peoples regarding the possibility of what will happen if the schools are open. And we know that there is the past experience as well as from the international, when schools are opened, definitely there was some surge. And regarding children, because we know in the latest Sero survey report, even children also were found to have antibodies more than 50%. So with these remarks, I will now invite Dr. Rahul to start today's topic. Over to now, Dr. Rahul.
So, sir, good afternoon, everyone. Thank you very much. I was told that this is going to be a panel discussion type of a thing. So there is no presentation. There's specific things you want me to talk about as a perspective of the third wave. I'm happy to talk. Yeah. So essentially what we are looking at in the data which you just presented, whether we are actually having a third wave or not is the big question. Now, as the data was already presented by you, 70% plus cases in the country are coming from one state, which is Kerala. And the cases actually increased significantly in Kerala around the time the relaxations were given in the restrictions which were put on before Onam. They actually relaxed the restriction for around 2 weeks before Onam. And following that, the cases increased exponentially. And what we are seeing is the result of that relaxation given in those rules, which is probably going on. Now, what's the good thing and the bad thing about it? The good thing is that Kerala has got the highest number of vaccinated people in terms of population percentage. So a lot of people have some amount of immunity. The bad thing about that is that Kerala was one of the states which had actually done extremely well and had very little natural infection of COVID-19 in the first wave as well as in the second wave. So what you are seeing is a divided wave here in Kerala. You are seeing two divided waves in Kerala. You saw the first wave, which happened when the whole country was going through the second wave, and now you are seeing another divided wave, which is happening in the country right now, which is predominantly limited to Kerala. So you've got Kerala, which is actually having two phases of the second wave going on. So what about the rest of the country? Well, a bit of Northeast, West Bengal, and some of the South Indian states surrounding Kerala are experiencing a slight increase in the cases. The states which are giving more than 1,000 cases per day are Maharashtra, Karnataka, and I think there is one more state which is probably Madhya Pradesh, if I'm correct. These are the states which are actually giving more than 1,000 cases a day. Maharashtra is a very peculiar one. Maharashtra, the tail has been extremely thick. It has never really come out of the second wave. And I'll be very honest, it never really came out of the first wave either. So we always had cases going on. We had around 1,000 cases a day going on between the first and the second wave. And we have now the 4,000 number, which we are stuck to in the last 2 months or so. But if you look at the test positivity rate, slowly but gradually the test positivity rate has creeped up. And I think we need to be very, very cautious over the next 1 to 1.5 months, because we've got some good festive time coming up. We've got a Ganesh Chaturthi, which is, celebrated in a very positive way and at a very large scale in states like Maharashtra. Then we've got Navratri, which is coming up, again celebrated quite extensively in the western part of the country as well as the southern part of the country. But the dancing and everything which sort of goes across has a lot of bearing on how the infection is going to spread. And then we have the Diwali coming up, of course. So I think the next 2 months are going to be actually very, very important and crucial to look at. I believe that we should be not celebrating any of these in the usual pomp and grandeur which we do all the time, every year. We should probably tone it down to the current prevailing situation, which means that our COVID appropriate behavior has to be the center stage in which we are going to celebrate any festivities. Of course, the states will decide how much relaxations need to be given depending on their condition in terms of the test positivity rate and the prevailing infection. We cannot generalize that and say, but I think the COVID appropriate behavior needs to be followed by citizens. So the message for citizens, doctors and nurses and everybody would be that your COVID appropriate behavior needs to be followed, which is the important part is masking and avoiding crowded places. If we can do these two things as responsible citizens of the country, I think we will be able to have safe celebrations of these festivities. At the same time, the third wave will be pushed backwards. Why am I saying so? If you usually look at the waves, there is a 100-day cycle. That's where the wave comes in. We have 100 days of cases going up, plateauing, and then coming down. And then we've got 100 days of approximately no cases or very few cases across the spectrum. If we can push this 100-day gap to 200 days this time, this will allow our country to complete the vaccination. And then we will be in a state where we may get cases. I'm not saying third wave will not come. I think it's a question of when it will come. And when it will come, a lot of it lies in our hands. If we behave properly, the wave will be pushed forward to 200 days, allowing the government to complete the vaccination. And then we'll be in a state where Kerala is there right now, where cases are coming, but we don't have a lot of hospitalizations, which is the best thing to sort of look at. We don't have a lot of hospitalizations. We have patients who are being managed at home, and the healthcare system and the healthcare infrastructure is not burdened at all. I think this is the scenario which we should be looking at, and that is the scenario which will probably give us a protection. Because remember, vaccine is being given to people as a savior for life and critical illness. It may not stop infection, as we now know from the rest of the world where UK and US data is coming in. A substantial number of people have had breakthrough infection. But the good news is that there are hardly any hospitalizations and even fewer deaths in that group as compared to the non-vaccinated group. So I think the vaccine, masking, and avoiding crowded places and maintaining social distance should be the norm, is what I feel. I don't think we are going through a third wave right now. I think we have still got opportunity in our hand to push it as much forward as we can. But the margin of error is not in months, it's in a week or two. So if for a week or two we don't behave as normal good citizens of this country, where we actually flout the rules and then have super spreader events, then we will actually push the country into a third wave. I think so. We need to be very responsible as citizens of this country. As healthcare professionals, we need to lead from the front. We need to make people aware that this is what we are looking at, and a little bit of caution, just a little bit of caution in all of this, and we will be fine. With that, I would be happy to take any questions, any specific things we need to talk.
Yeah, before we start, we invite the questions. There is a lot of apprehensions, especially among the parents, with the opening of schools. Do you think, what is your view regarding the children if third wave suppose comes in? Because festive season is on, we see the people, how people we see in the rush crowding in the markets and other areas. In spite of so much messages and guidelines and awareness by the governments and by the various associations, still we see COVID appropriate behavior is not being followed in true sense, and there is a crowding. With the opening of schools, what is your view and how we can prepare the parents? And because now schools are almost closed for more than 1.5 years, and children are definitely developing other problems, the mental issues and obesities and other things, besides the academic loss. So what is your take on this opening of schools at this moment, especially before the just festive season?
Sure. So it is a difficult topic to answer in a very honest way, but I will try to do it in a scientific way. Okay. So if you ask me, we are doctors, we are nurses, we are healthcare professionals. We know what side effects are happening to children because they are not going to schools. Okay. So we have to look at, is it prudent to open the schools? We haven't opened schools in Maharashtra yet. We haven't given that permission to the schools yet. So what is it that we should be doing? We should look at the countries which have opened up schools and have actually had to go back and roll back their decisions to close them down. The recent reports which have come up from a couple of states from US, where up to 500 children have been positive. Remember, we are dealing with the variant which is the Delta variant. Delta variant is as fast spreading as chickenpox virus, which we all know is an extremely fast spreading virus. The R factor is very, very high. Social distancing and masking, if we as adults are not able to adhere to it, it would be naive to think that our children would be the ones who would be adhering to it. Okay. Again, when we talk about our children, we have to categorize them into two different subgroups. One subgroup is between 12 and 18 years of age, and the other subgroup is less than 12 years of age. I think there's a good increasing school of thought which says that if at all schools have to be opened up, of course, looking at the prevailing condition and all those things, let's say we decide to open up the schools, it may be easier to open up the schools in the primary section rather than the secondary section, because they probably carry the disease much better than the children between 12 and 18 years of age. There is a natural immunity offered by the thymus gland, because of which these children have got very little or no disease symptoms, which is again a double-edged sword, because they may be completely asymptomatic and spread it. So that's why there are norms being laid down by the government of Maharashtra. The pediatric task force has done that. And those norms, one of the mandated norm is that every adult who works in the school, whether it's a teacher, administrative staff, principal, housekeeping, help staff, whatever it is, they all have to be vaccinated doubly and have to have the 2 weeks mandatory period after the second dose done. Only then they could be allowed in the school. And if we are able to have that kind of environment in the school, I think then you can probably open up the schools a little bit safely. Coming to your question, whether third wave would affect children or not. Again, I think in the knowledge which we have from UK and US, the absolute number of children infected has definitely gone up. In some states, as high as 9% of the total people who are infected. So let us say the second wave is less than the first wave, but higher than less than the second wave, but higher than the first wave, and we are somewhere in between. We would still be looking at a substantial number of children. If anywhere we are looking at 5 to 9% of the total infected population. And currently our country is gearing up. Many states have now completed and have got sufficient supplies and support system to look after children. But we need to be very sure that we'll be able to look at those kind of numbers, because we had around 4 lakh cases per day positive in the second wave, which was the peak, and just under 1 lakh cases per day positive in the first wave during the peak. So let's say we are even at the first wave during the peak, and even if you have 5% positive of those are children, we are still looking at 5,000 children who would be positive every day. So I think this school matter is something which needs to be very, very delicately looked at. Children need to be sort of made to understand, and a lot of role play has to come from parents. If parents are able to wear the mask and not crib about it in front of their children, I think we will be actually doing a lot of favor to them, because children, especially the one below 12 years, tend to follow their parents. If I go home and throw my mask and say, I'm fed up with this, when am I going to get rid of this mask? My child would probably not follow it as well. So these are some of the things which we need to look at. Thank you.
Yeah, you're absolutely right. Strict protocols, school protocols have to be looked into and strictly adhered to when we are opening up the schools. And yes, there's a debate whether younger schools children should be allowed first or the senior one. That is a matter of debate. Now, regarding the masking, so we see most of the people, and so many different varieties of masks are available in the market, and most of the people use the fabric mask. Do you think is it a right approach to use any kind of a mask, or what will you have to say on the use of mask?
So I have a very clear thought process on that. I think you need to wear a 3-layer mask. And if you're using a fabric mask, you should be wearing a double mask. It's as simple as that. If you are not wearing a fabric, if you're not wearing a fabric mask and you're wearing a surgical mask, I think it would still be good to have a fabric mask, and on top of that, you wear a surgical mask. So I am the one who proposes to wear double masking all the time.
Yes.
And for healthcare worker, N95 mask. And I can give you my reasons for that. It's not just the number of layers around your nose and mouth, but the second mask actually helps to fit the leaks and the gaps which the first mask leaves. None of us have a perfect face where the mask would fit tightly. We always have some gaps. So if you have, unlike an N95 mask, which actually fits very tightly, even that requires a little bit of fitting in the size. But if you have a second mask which goes above the first mask, it gives you very good seal around the face. And that way you are able to have a safe, movement within the society in the norms of the COVID appropriate behavior.
Yeah. So absolutely, it's very important nowadays to have a double mask, surgical mask, over that a fabric mask, to ensure it is fit, is it tightly fitted on your mouth, which covers both the nose and the mouth. And more than the quality, it is a fit. How it fit it is, that's more important for the purpose we use masks to prevent infection. Absolutely, you are right. Anything else you would like to convey to our audiences?
No, so I think we've talked on the right
Can we have
direction.
question answer then? Anji, Dr. Miss Ruchika, please, any question answers? I will invite the participants for questions. You just see if you have any questions.
The floor is open to ask any questions. Participants, you can have any, if you have any query, you can please ask.
Professor Ramandeep?
Yes, sir. I would like to ask one question, sir.
Yeah, please.
Like at government level or national level, are we ready to tackle with the wave 3?
Okay, very good question. I trust me, a lot of hard work has gone in, And I can say this with a fair amount of conviction from Maharashtra and for the government of India as well, from what I'm hearing. So a lot of preparation in terms of two things: manpower as well as resources, as well as the other would be the medicines, hospital beds, ICU beds, pediatric beds. In Maharashtra, we've been doing this for last almost 2.5 months on a very, very consistent basis. So a lot of planning, looking at models, various models from IITs and IIT Kanpur and stuff, looking at the predicted numbers, and then preparing for the worst and hoping for the best is what our attitude has been. So looking at pediatric size ventilators, pediatric circuits, pediatric IV cannulas, and then of course scaling up the adult as well as pediatric beds, adding up more jumbo units in the cities, adding up a process where how a pediatric or adult patient would be transferred from one place to other place, looking at our oxygen stock, very, very sensitive. How much stock is going to be available for us to use at the peak? Where are we going to be deficient? Put up bigger hospitals with pressure sink absorbers so that the PSA units, so that they are actually self-sufficient with their oxygen requirements to a certain extent. All of that planning has happened in Maharashtra. And on a similar thought process, the government of India is also doing a lot of extensive planning. And I think they talk to each other as well, the state as well as the center. And I can tell you the efforts are done. But what happens is that when it actually hits, and what happened during the second wave was it hit us like a tsunami. Before we knew, we were having lakhs of cases in our hand. I think that kind of a planning never gave us a time. But this time around, I think the planning is better. Definitely it looks better from what I'm hearing. And I see that on the ground in Maharashtra as well. So we are hoping that this time we are better prepared. One thing is for sure, we understand the virus a bit better now. We know that this Delta strain, we are very, very cognizant of the fact that this new strain, which the C.1.2, which is now deemed to be more infectious than the Delta variant, has been identified in South Africa and 4 other countries. So we are now we are doing more genome sequencing than what we did before. So we will probably be able to identify the mutant strain. What's the worry? The worry is that it mutates again, and the mutant strain becomes more infective and more lethal. That's the biggest worry. If we identify it early, and if we're able to ring fence those areas where we actually find a difficult strain to treat, I think then we will be able to do better justice. So I think that even the epidemiologists have now better information in terms of genomics. So we are definitely better placed.
Yeah, definitely. You just talked about the new variant, which recently has been identified from Colombia, that is named as MU. Yeah, which is supposed to be having much more transmission capabilities, and maybe it will evade the immune. So what is your, just to give us something, if you can talk on the variants of interest and variants of concern, so that you can give some insight so that our
participants. Yeah, so I think at the moment we should be only worried about the Delta strain. So there are a number of other, mu is there, kappa is there, lambda is there, C.1.2, 1.2 is there. So there are a number of variants of interest which are there. C variant has not yet become a variant of interest or concern right now either. But the other ones are slowly becoming variant of concern. But the predominant variant in the whole world currently, more than 98% in some of the countries and more than 94% in India, is Delta variant. Delta variant is highly infectious. And again, let me just bring it for the perspective of common people. No matter what variant it would be, if you do your masking properly, absolutely properly, do not breach your mask at all, any variant would be fine, even if it's around you. But the moment you drop your guard in front of people who are not masked, I think we are inviting trouble. There is no two ways about that. Absolutely no two ways about that. The second is that these variants of concern become variants of interest when they start replicating. So what makes a variant interesting? What happens is that the virus is changing its clothes every day. It is trying to protect itself, just like we change our clothes every day in the morning. We are trying to protect ourselves, our skin, our dignity, everything. The virus does that to protect itself because it has to live. And while making a copy of itself, it makes millions of copies of itself. One of the copy gets defective. And if it gets defective at the receptor binding site, then that defect gets copied. When you have several such defects which get copied up, you actually develop a strain which then probably can have 3 or 4 different things. It might become less infectious and less lethal, or it can have a combination of being more infectious but less lethal, or more infectious and more lethal. It all depends on which receptor binding protein has the mutation occurred. And once it occurs to a point where it becomes more infectious, and it keeps on changing and mutating very fast, and we remember a virus is usually mutating around once in 2 weeks. We are getting newer and newer strains once in 2 weeks. That's the rate at which it is developing. It is mutating right now. The C.1.2 is now already showing 48 mutations. So it's a very, very rapidly mutating virus. The more it mutates, the more chances that it will become more infective and spread across the world. That's what happened with the Delta. Now, we must have heard of Delta plus cases. Maharashtra has had Delta plus cases. Some other states have reported. But we haven't seen that into the same extent of what Delta variant is there. So it looks like Delta and Delta plus are not too different. They are probably the same. It has got a different genomic structure, no doubt about that. But in terms of infectivity, in terms of lethality, in terms of virulence, it seems to be the same. So we need to remember that whenever a strain comes in, it will become more virulent and more lethal. If it becomes more virulent and more lethal, that's when we need to be calling it as a variant of concern. Otherwise, there are a number of variants which are coming up all the time, and not all of them become even variant of concern or variant of interest.
Yeah, so take-home message for common man on this variant issue is that they should strictly adhere to the general precautions for infection control and prevention, what we have learned so far, COVID-appropriate behavior and vaccinations. While regardless of the various strains, so far the vaccines available as on date are effective against most of these variants. Maybe some efficiency may be reduced, but they are effective. So yes, a common man must continue to adopt to the general principles of infection control to control this COVID-19. It is not a matter of worry for a common man what variants are being detected and how they are behaving. If every citizen should understand his or her responsibility to strictly follow the COVID-appropriate behavior, as well as get vaccinated if he is more than 18 plus. Now, there are so many trials and vaccines have been approved for use in children, especially more than 12 years of age. So schools are opened up. What is you have to say on pediatric vaccinations? When we are going to start in India?
So we've already got the ZyCoV-D, which is approved. ZyCoV-D actually has 1,000 patients, which were children out of the 29,000 they had enrolled. I think we should be able to quickly ramp it up. So whenever we actually have an emergency use authorization, what we have seen is it takes around a month and a half for the vaccine to be actually available in the country for use. So the emergency use authorization had happened now around 2 weeks ago. So I'm expecting that somewhere in the month of September end or October, we will have this vaccine available. And then we will essentially be able to roll it out gradually. The children between 12 and 18 would be the ones who would also have probably another vaccine coming in their way, which is the Covaxin. I think with the 2 vaccines coming in, we should probably have good amount of children covered up for the vaccination. The only thing is that, again, the time interval between the 2 doses would have to be looked at. And unless the 2 doses are complete and 2 weeks have gone beyond that, and for ZyCoV-D 3 doses have completed and 2 weeks have gone beyond that, we cannot say that they are fully vaccinated. Now, on that line, I would like to digress a little bit and just talk about the little Sero survey which has come out, and a lot of small papers now which have come out. surgeons looking at the antibodies in children before operating on them, so on and so forth. And most of these studies show that somewhere between 70 to 80% of our kids already have antibodies. That is something which has come out, multiple small studies. Even the Sero survey which came out talked about it, but multiple small individual studies scattered across the country have shown that children are having somewhere between 70 and 80%. So there were varied reports of that, but that's the number we are looking at. And interestingly enough, many of these children are from families who had no COVID cases in them, in the immediate family members. So despite that, they have developed antibodies. So I think there is some heartening news here that some of our kids definitely probably have got a good natural immunity from COVID-19. That does not by any way mean that they should not be vaccinated. Don't get me wrong, please. They should be vaccinated when the vaccine comes up for them. But we probably should be also aware that they have had subclinical or asymptomatic infection already, and it went completely unnoticed, which is probably a good thing.
Yeah, this is a good heartening news. Seen from the earlier data and whatever reports are there, is very encouraging. Even third wave comes and children are affected, most of them will be asymptomatic or they will be having very mild, just like a common flu. All children get nowadays. Now season of flu, common flu is there, and so many families we are seeing the cases of this running nose and all this fever, viral fever. So like that, and parents should be relaxed. They should not be having so much apprehension regarding third wave and children will be affected. What will happen to our children? So that at least, especially the mental problem which this COVID has brought in, something you kindly talk about the mental health issues, or especially with how we should deal with the children or even other adult population also who are having some mental symptoms.
Yeah, so I think one of the things of COVID-19, unfortunately, one of the fallouts of COVID-19 has been mental health issues. And several problems have emerged, especially the long COVID has given out to several mental health issues. In children, unfortunately, just by the fact that they have been tied down into the house, it's almost like a housebound arrest, house arrest for them. Children who love to play, who love to go out, mix with their other friends, and they had a vibrant personality, suddenly have been kept into house, into the confines of the four walls. Obviously, that kind of a environment is not going to be conducive for their mental health anyways. And then there are adults who have probably gone through the bad parts of COVID themselves. There may be families who have lost a loved one, unfortunately, or there are families which have gone through hardships because of lockdown. Maybe because of COVID, they had to lose their job, or maybe because of lockdown, they had financial loss. And those are the people who have had several mental health issues. And trust me, a lot of them are still not surfacing up. They're still trying to deal with themselves. Mental health carries an unfortunate stigma in our country. Even within my family, if I talk about with my family members that you need to see a counselor because you're going through a hard time, it is almost immediately brushed under the carpet and said we don't have a problem. I see it with my patients as well. Every 10 patients I refer to a counseling, maybe 2 of them turn up to a counselor, 8 of them still deny that they actually have a problem which needs to be sorted out. And I don't know how we can actually bridge this gap in a short time. It may happen probably in 15 years. In 10, 15 years, we may be what West is today. But we can't wait for 15 years. We need something to happen within this year. So I think a lot of awareness needs to be generated about this. And I think we are not doing much in terms of creating awareness about the mental health issues for COVID-19. We talk about it in medical forums like this. We may have some non-medical people listening to it, but we are not talking about it largely on television. I must have had hundreds and hundreds of television appearances this year. I remember only one which was dedicated to mental health and COVID. And I'm not joking. Maybe 300-400 television appearances in the last 1 year, but not except one. I don't remember anybody taking mental health as a center stage. Maybe there are some where I was not invited. Of course, there would be some where I was not invited, and they did hold them. But how many of them have actually created an awareness? Is there an awareness week about mental health in the country? We need to create that kind of an awareness. Psychiatrists and psychologists, I must say, they again have not taken the leadership in this to the extent that we would like them to take. The physicians and the intensivists, how they are leading the clinical battle from the front. I think psychiatrists, psychologists need to lead the mental health battle from the front right now. A lot of fear about, because in the initial phase, it was even difficult to find a psychiatrist or psychologist to review a patient. They were just not there in the hospitals. Now we have a lot of people who have joined back work and who are actively taking up patients and seeing patients in person, online, whatever it is. I think we need to start seeing these mental health issues in a much more positive manner and try and get help to these people.
Yeah, absolutely right. So every schools and teaching institute, now there is a need to have a counselors available at least once or twice a week. Many students will require, because more than 30% of the children and the college students are having some kind of a mental issues, and they require some counselings. COVID has taught us the role of counseling and the counselors' use of counselors.
Sir, I think
Last,
we have some questions
yeah,
from
please.
students. I think
Yeah,
we have
please.
some questions from the
Please.
we have some questions from the students.
Go ahead, please, madam. Please ask.
Sir, there have been few questions from the participants. First states, where are we seeing our country's health infrastructure in terms of handling the third wave, if at all it happened?
I think we discussed about that. We actually answered this question.
Next is, as we know, people have been vaccinated. So do we need to again have any booster doses of COVID-19 vaccine to boost our immunity?
Good question. Good question. I was expecting this question. Good question.
Yeah.
So let's break it down. Okay. So the purpose of the vaccine is not to stop the infection, but to stop the deaths and severe infection. I think that's where the vaccine is first aimed at. Remember, to eradicate a virus like smallpox or polio, it took us decades of vaccination. So if somebody is expecting that by 1 year of vaccination, we are going to have no infections happening, it's not going to happen. No amount of booster, what you take is going to stop the infection. But deaths, it will stop. That's the first scientific part. Now the logistic part. There are several million people in the country who have not had their first dose yet. How prudent it is to offer for a third dose for a select few. That's the second logistic part. Then the third part, which is the problematic part, is that I may say both of these first 2 points, but the reality is that I would still need healthcare workers and frontliners to work for us, not to be confined to their beds at home. And the vulnerable population in the country, which is immunosuppressed, who are not able to mount any antibody response, they may require a third dose. So I think once the vaccine supplies are good, this question may be again discussed in length, and probably the frontliners and the vulnerable population should be offered a dose. But right now, when the vaccine supplies are literally limited to the number of people we have in the country, and it is coming yes, it's definitely doubled up, tripled up in the last week or two. It's definitely very, very good. But we've still not reached the target where we know that 100% of the vaccination is completed now. So I think we need to just wait for the booster dose for a little bit more. I don't think anybody would advise a booster dose currently. It's on the card. We should start discussing about it. We should probably start having the exact studies aimed at which patient would benefit, which person would benefit from a booster dose. We don't have that kind of a study for Covishield and Covaxin, which are the two biggest vaccines in our country right now. So I think we need a vaccine-specific study on the population to understand who would benefit from a booster dose.
Another participant has a doubt, like, is it good wearing mask for the long time?
Is it good wearing mask for the long time? It looks like right now, I don't think there is any other option. In fact, let me just give my 2 cents of advice on this. Whether we like it or not, whether it's good or not, till 31st December 2022, please continue wearing a mask. After that, I don't know. But Baba Rahul Pandit is saying this right now. The Guru Rahul Pandit is saying this right now. The humble Rahul Pandit is saying this right now. The Doctor Rahul Pandit is saying this right now. The crystal ball Rahul Pandit is saying this. Please, please, please wear a mask. Whatever form you may see a doctor in today, please wear a mask.
A quality mask, not only a
Yes.
fabric mask.
Yes, yes.
It's
a
more
quality mask.
important. Quality mask is a must. Any other question?
I guess no, sir. We had only these questions from the participants.
Okay, in the last, I will request Dr. Pandit to talk about something about new updates on the management part of COVID.
Yes. Yes, I think again that's a very pertinent thing. So there are a few new things which have happened in the last 4 or 5 months. Some of you may have already heard of it, and I might still like to just recap upon that. The first thing which has happened is that we now have the monoclonal antibody available. The monoclonal antibody combination, which we call as monoclonal antibody cocktail, which is casirivimab and endivimab. Expensive drug, but now we have a definite treatment for COVID-19 in the early phase of the illness. So if somebody who has got 12 years and above age, who is 40 kilos and more, and has a coexisting comorbidity like obesity, hypertension, diabetes, ischemic heart disease, liver disease, kidney disease, immunosuppressive disease, or is on immunosuppressive tablets or medications, or a cancer survivor or a cancer patient, this category of people, if they get a COVID-19, even after 2 vaccines, probably can be utilized as a potential patients who would need to be given this COVID antibody, this COVID-19 cocktail antibody. And that has to be given preferably as early as possible on day 1, if you can diagnose it. And day 1, preferably within the first 7 days, and definitely before hypoxia sets in. So if you can give it at that point, it is probably going to save a lot of people's life because it stops them from progressing to hospitalization. That's one of the big treatment challenges. But can it be an equitable distribution across the population? Because it costs 60,000 rupees, it is unfortunately limited to a very niche section of the population who are able to afford that. And I think as many and many more antibodies would come in the market, this costing would come down as well, and it would be accessible to more and more people. So that's one of the big treatment changes which has happened. The other treatment change which has happened is that we would probably be having few more drugs which would come up, but most of these drugs have not been tested in large scale randomized controlled trial. For example, aspirin has been tested in large millions and millions of patients with coronary artery disease, and there's no doubt that we need to use it. But these antiviral agents like favipiravir, molnupiravir, then you have got ivermectin, they have not been tested in small individual groups, maybe hundreds of patients, maybe a few thousand patients. So I think there will always be a positive trial and a negative trial. I think the crust of the matter is that as long as you use it within the range of the disease process and the safety margins which the drug would have, you can use them. Some of you may say that there is no evidence for it. Some of you may say that why not give it and see. I think the problem occurs when we start stretching it out of the boundaries. Like somebody may use them for prophylaxis, it's not done. Somebody may use them later on in the disease. For example, remdesivir, they may want to start on 7th or 9th day. It's not done. It's not going to act then. So I think everything needs to be done in the box in which it was studied and was meant to be used. And in that case, and within the safety margin, then you can use it safely. Steroids definitely have shown to be the best medicines right now for patients who have hypoxia. For patients who are non-hypoxic, there is no role for steroids at all. Then when it comes to admission, we have got remdesivir, which has got mixed data again, but most people would use remdesivir in a hospitalized patient, provided they were well within the first 9 days from the onset of illness, and not from the time of being positive. The third thing is there is now emerging data about tocilizumab, the recovery trial data, and there's another study after that which shows that if you do need to use tocilizumab, a single dose of tocilizumab within the first 24 hours of worsening and intensive care admission, within the realms of effectively ruling out sepsis, which is bacterial as well as fungal and tubercular, and a rising CRP or a IL-6, despite the patient being on steroids for at least 48 hours, 24 to 48 hours. If all of these criteria are met, only then think of a single dose of tocilizumab which can be given. So this is the current evidence. Apart from this, there are a lot of other drugs which are there. Bevacizumab and infliximab, pegylated interferon. I think the 2DG, I think the studies are there, but we need more and more data to be actually including them on guidelines as medicines to be used. That's my take. One thing which cannot substitute for drugs is good care. Now, most of us need to realize that it is a good hospitalized care, good intensive care, timely ventilation, timely intubation, timely putting them on HFNC or BiPAP if required. Those are the things which are going to actually be the most useful things for any viral illnesses. Okay, over reliance on medicine is just going to push us backwards and not going to help us out.
Thank you, Dr. Rahul. Ruchika ji, if no questions more, then please conclude the session. Nana ji,
Yes.
anything you want to say? Mrs. Nana Agarwal ji? Is she there? No. Over to Ruchika.
Yes, sir. Thank you so much, sir, for enlightening us. First of all, a very warm and cherished afternoon to most of our valuable chief guests, Dr. K.K. Kalra, Director, Quality and Safety, Heartcare Foundation of India, and also Dr. Rahul Pandit, Director of Critical Care Medicine and ICU at Fortis Hospital, and all of our most valuable invited participants. It is my privilege to propose a vote of thanks and acknowledge the contribution of those who worked hard to make this occasion a success. On behalf of the SGT University, I, Ruchika Duggal, Assistant Professor, Faculty of Nursing from SGT University, would like to, and also along with the entire fraternity of the Institute, would like to extend my hearty thanks to the Honorable and respected Chief Guest, Dr. K.K. Kalra, who gave his vital time from his busy schedule to grace the occasion and also host this occasion. I want to thank Dr. Rahul Pandit for adorning his necessary work and sharing with us his graceful opinion. You have created a good spark, sir, and gave us and also the new participants an insight to let the participant think how to think differently, which is really noteworthy and amazing. Further, a big thanks to the whole team of the Heartcare Foundation and also Ms. Sapna for organizing this event. I also would like to extend my heartfelt thanks to Dr. Sunil Kumar, Dean, Faculty of Nursing, SGT University, for providing encouragement and supporting us continuously in organizing this event. I must mention my deep sense of appreciation and extend my gratefulness to Professor Dr. Ramanti, ma'am, HOD Mental Health of Nursing, Faculty of Nursing, for perfectly supporting us and for guidance she has extended to all of us. Well, an event like this cannot happen overnight. The wheels start rolling weeks ago. So it requires a bird eye for planning the details of an event and what topics need to be focused upon in the current scenario. So I want to heartily thank all my dedicated colleagues of the SGT University Mental Health Nursing and also the other faculty members of the institute. I also sincerely thank all of you. At the end, I express my thanks to all of the participants who attended this webinar with great enthusiasm today. Thank you all for being with us today and have a wonderful day ahead. Thank you, sir.
Thank you.
open with a quote from Thomas Edison. He said, "The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition." Are we there yet?
We're en route.
So tell us about what you do at the Center for Integrative Health and Center for Integrative Nutrition.
So at the centers, we have a broad-based set of integrative approaches to healthcare.